In this video, I'm going to go over 4 easy techniques that you can do to reduce your carpal tunnel symptoms. So what happens in carpal tunnel syndrome? The median nerve is compressed as it passes through the 8 carpal bones here in the wrist. So that nerve goes into the hand, supplies sensation to the thumb, the index, the middle finger, and this inside portion of the ring finger, and then this part known as the thenar eminence of the hand. So you may notice a loss of ability to manipulate items, pinch items, hold on to things, maybe dropping things, may have difficulty with buttons and snaps, zippers, all those types of things. And so that's just because of compression of that nerve as it travels through the carpal tunnel. Now, it's the only nerve that travels through the carpal tunnel that goes into the hand. The ulnar nerve and radial nerves, they do not pass through the carpal tunnel. They are outside of that, and they have distribution of sensory and motor components to other parts of the hand. The first thing we're going to work on is going to be a nerve glide exercise. There's a lot of these different exercises. There's all different kinds. This is just one that I like the best. So what you're going to do is you're going to bend the elbow so it's flexed. The wrist is flexed. My fingers are down. And what I'm going to do is go all the way out as I extend my elbow, extend my wrist, extend my fingers. I'm going to tilt my head away from the side that I'm moving. So I'm going to go over, and then I'm going to reverse that when I come back. Just back and forth like this. Now, an alternative version of this that you can do is my head is going to be away, my fist is down this way, and then when I go out, I lean towards the side that I'm going towards. So you can do that either way. You're going to repeat that for 4 to 5 times, several times a day. You also can do that out to the side. So a lot of times people will do that out to the side so they're in this position and they'll go out like this, which is fine, or they can start this way and then you can kind of go with the hand as it goes out into extension. Either way is fine. Just kind of work with that, see what your preference is and which feels the best. If it's too painful, it reproduces your symptoms to really an uncomfortable level, then back off. Don't go as far. Maybe don't stretch it as far when you go through that movement, or reduce how much you perform that throughout the day. Next is going to be a wrist flexor stretch. So that flexor mass here on the inside of the forearm that travels down, those tendons, a lot of those will pass through the carpal tunnel. And so what you want to do is work on stretching that. So we're going to extend the elbow out, bring the wrist back into extension. That also is going to help stretch a muscle here called the pronator teres. So sometimes that median nerve that's passing through here in the carpal tunnel can become compressed back here under the pronator teres. That's known as pronator teres syndrome. So we're just going to go ahead and stretch that entire area. You're going to hold that for around 20 to 30 seconds and relax. Go back in, stretch again, 20, 30 seconds and relax. Repeat that for 4 or 5 times, several times a day. Now we're going to work on tendon glide. So this is where we're going to take the tendon and kind of slide and glide it through all the points where it goes around what's known as the pulleys of the hand. So what you're going to do is start with your wrist in neutral position. Your fingers are pointing straight upwards. You're going to curl your fingers down. That's known as a hook position. And you're going to roll that down into the fist. Then you're going to extend your fingers out. That's known as tabletop. And then bring your fingers back all into extension there. So we're going to start here, curl them down into a fist, tabletop, bring them back up. Curl down, roll into the fist, tabletop, back up. Repeat that for 10 to 12 repetitions for a couple of sets, several times a day. My last step of recommendation is using a carpal tunnel splint, a wrist cock-up splint. You can buy one that's prefabricated, or a therapist can make you one. And that's just where it brings the wrist into a little bit of extension here, sometimes a little deviation, just to take some pressure off of that nerve. That works really well if you wear those at nighttime while you sleep, just to take pressure off throughout the night. If you can wear them sometimes during the day, that's good too, but not always does your job or your daily task allow you to be able to use a brace like that. But if you can, it does work really well. So I definitely recommend using a carpal tunnel brace or splint. Thanks so much for watching. I hope this video helps with your carpal tunnel syndrome. Be sure and hit that subscribe button so that you can stay up to date on all my content.